lot of times patients will ask me, what do I think about fat transfers? The way that I look at it, fat transfer is a very useful technique. What we do is that we take liposuction, we utilize that as a technique to harvest fat. So we get fat from one given area where you have too much, and then we preserve that and prepare it, then introduce it into a new area to create volume. So the way that I think of fat transfer, it's not a procedure by itself. Rather, fat transfer is part of something else, whether it's a facial rejuvenation, whether it's a restoration of contour, whether it's something to get rid of a divot, or whether it's an endpoint by itself, like in a Brazilian butt lift. The whole idea is that we're taking tissue from one area, using the technique of liposuction, and we position it someplace else to create the given result. So I think that we have to be careful in terms of how we do it. Where do we do a lot of it? Where do we do very little? When should we be cautious about it? And when is it a valuable component? But where I bristle is when somebody wants to have fat transfer and they feel that that is the end point or that is the entire procedure. It's not. It's a tool. So I think that the best way to determine whether you can be benefited from fat transfer is to define the question of what exactly do you want and what are the different tools that I have at my disposal to give you that best outcome.